the burden on the different wellness professionals. We'll talk about how to do that, like tips and ways to kind of keep your community referrals and parents engaged. And then we'll also just sort of spend a little bit of time talking about tips and strategies to reduce your own burnout and well-being, because again, this is a really tough job that we're all in. So some of this is nationwide, but I know some of these challenges are like especially different and unique in Orange County and in private school settings. But overall, I think we all know we're seeing a worsening of mental health in teenagers. So that just probably means larger caseloads for school counselors. Everyone's kind of feeling the burden of long wait lists. Obviously challenging parents. And I know, again, some of this is especially unique in our socioeconomic area here in Orange County. But a lot of times parents can come in really defensive or litigious. And again, those things can be really challenging and take away from the actual work that we're trying to do with the students. I'm sure a lot of schools are too familiar with just administrative challenges that, again, that are slightly different in each private school because they're just a little less standardized than maybe the public school setting where our system is in place for a lot of these things. And then just a limited access to resources. I know we're going to talk about how important it is to, utilize your community and refer out when needed. But we also know that a lot of community referrals are hard to come by, and there are long wait lists everywhere. So all of these things really do lead to high levels of burnout. And so I'll talk a little bit more about burnout on the next slide here. It's basically, it's characterized by these three things: physical and emotional exhaustion, when you start to feel cynical and detached with your work, and you just sort of feel ineffective and that you're not accomplishing much. And besides just impacting your quality of life, burnout really does kind of limit your value at your office because you cannot be as effective as you want to be. And we know some of the risk factors of burnout. And I will say, wellness professionals and school faculty in general experience twice the level of burnout nationwide compared to most other professions. So anyone in the helping profession is kind of at a high risk, but also the schools make you high risk too for these kind of these feelings. So it's just really important to kind of be mindful of this stuff. So risk factors include a lack of control. So when you feel like you can't practice the way you want to practice or do what you want to do, because whether it's administrative challenges, parents getting in the way, or just like not knowing who to turn to for supervision or professional consultation. When your job expectations are not clear. And again, I know some of these schools, like as the mental health issues are growing, schools are trying to keep up and catch up and figure out their plans and what to do to support all of these needs. So sometimes that can leave expectations for what your role is really unclear, and that can be challenging and lead to burnout. A mismatch in values, and I'm going to talk more about this later, so I'll kind of just leave it at that for now. Again, we also know with the worsening mental health crisis, kids are presenting now with pretty serious clinical disorders like eating disorders or personality disorders and things that might feel outside of your current training or scope of practice. And so that can also leave you feeling overwhelmed and burnt out. And then just in general, just a lack of social support or work-life imbalance will obviously lead to feeling burnt out. So to kind of alleviate some of the burden of the work that you're doing, we wanted to kind of really stress the importance of collaborating and really using parents and outside providers, again, to sort of like share the burden of the work, but also to kind of make your work feel more meaningful, more useful, and more productive. So in the medical setting, they've developed this collaborative care model, and it's actually, it's shown to be very good and in kind of improving the outcomes of people who have mental health issues. And so it started basically by treating more people who have mental health issues in primary care. And so we know that most people go to their primary care doctor for everything, and they start there. And then what happens is the primary care started saying, like, let's consult with mental health professionals. So they would bring in outside psychiatrists or other, mental health therapists and case managers, and they would deliver healthcare, mental health care kind of through the primary care setting and then monitor progress over time. And they found that when everyone was on the same page, collaborating, and the kind of the PCP normalized mental health care, people were a lot more likely to receive the care that they needed. They limited a lot of access barriers, and it just provided great outcomes altogether. So there's some preliminary, studies that show that they're trying to adopt this in school settings. But almost, if you guys think of yourselves as the school staff as a PCP office, you're getting frequent contact with these kids, like way more than outside providers or even parents, and you have multiple vantage points, right? You have that, from the teachers, how they're doing with peers, how they do with authority, so you get, and you just see them every day. And so I think you're in a really valuable position to kind of normalize mental health care and help communicate between all the different, people involved in the lives of your students. So a big thing that I think schools are coming to us and asking about is, how do we just engage the parents? I know parents, there's probably a range. Some are too involved and some are not involved. And sometimes it's the ones that are not involved at all that need to be involved, right? And so, just as a general thing, instead of waiting until there's a crisis, make yourself known to parents, whether it's like introducing at the beginning of the year or, at certain time points, just introduce yourself and let them know who you are, what your services are. Frame it as a very positive thing. Sometimes people think like, oh, when the school counselor is involved, it's like going to the principal's office, right? Like, it's only a problem, versus you're there to be proactive in providing tools and tips and strategies. So if you have that kind of positive history of interactions with families, they're more likely to be receptive when you step in or intervene if there is a problem or crisis that pops up. It's also good to keep in mind that a lot of students and parents have not had positive experiences in the past. And so they might come across as defensive. So just kind of be aware of that and be mindful of that. Other things that other schools have done are like sending out a newsletter with resources, basic tips, education. Again, it's just other touch points where people are understanding that this stuff is valuable. You're normalizing it, destigmatizing it. And again, they're putting kind of a face to a name, or, a face to a service that's available to them. And they're more likely to kind of receive it and welcome meetings with you if something comes up. And then, of course, hosting any kind of wellness event for parents or families to talk about these things. Again, I know these things are challenging within each different school, but all of these things kind of, again, normalize what your role is in the school administration. And then in terms of collaborating, once the student is already on your client load, that those previous strategies are just kind of like to get parents involved in general. But once you're working with an identified student and you have to work with the families, just remain curious and open. Again, some parents are very insightful and aware, and they know what's going on and they are actively seeking support, and others may be completely surprised. So really ask those open-ended questions. Ask if it's okay to share what the school is noticing, get their permission. And again, approaching it from a place of curiosity and respect can go a long way in reducing people's defensiveness. Normalize that their reactions are okay if they're afraid, or if they don't know what you're talking about, or they're not viewing the same things. And you just want to communicate that we're all on the same page. So communicate those shared goals. Also, again, highlight positives before really going into the problems. Again, and it kind of feeding back to that last point I made on the last slide is, if you have a history of positive interactions, hearing some feedback is a lot easier for parents. And then focus on solution building. So we're going to talk again throughout this presentation on resources and things outside of school as well, but be open and honest with parents too about those things, and normalize that sometimes it's okay to step outside and get help from different professionals. And then, so once you do decide we're going to refer outside for this. Just make sure if you are handing out a list or if you have, some referrals that you're going to give out, it's good to know the people you're referring to, right? And so if you are going to refer to, so and so doctor, make sure you know that doctor and how they practice so you can kind of, educate the family or give them a heads up on what they might expect, and highlight that importance of collaboration at the outside so that they just know it's best, best care to talk and make sure that everyone's on the same page. And then educate them on confidentiality issues. A lot of people, I'm not sure how much you experience it at school, but a lot of times when we get referrals from school, the referral may come from school and then the parents are refusing to sign release for us to communicate with school because they're afraid. They don't know what's going to be shared. And, they're worried about confidentiality and privacy and how it's going to affect their students. Um, not only just reputation, but does this go on their record or anything like that? So the more you can really concretely educate them on what is being shared, that it's usually just brief treatment updates. We don't go into all the nitty gritty details of anything personal. They're more likely to be on board with that. Also, again, as you're providing that referral, it's usually good practice to just sign the release of information right away. So that way it's taken care of. And again, it's done more in a, here we're being proactive about this. We just want to have open communication versus when there's a crisis. Oh no, quick, let's sign so we can talk to this person, right? And I think it's always received a little bit more. It's just received better when you do it at the outset. Let's see. I think I kind of went over all of this stuff, but again, just using destigmatizing language is always a good idea because again, some families are a little bit more resistant to this stuff. Just to kind of touch base to when to refer to an outside provider, generally speaking, if your school-based supports if everything is in place and everything that you're able to provide at the school is not enough, right? So the kids are still having problems with attendance or tardiness or not turning their work in, or you seeing the mood changes, and or if their diagnoses or symptoms are at the clinical level, meaning it's outside of the scope of what the school can provide and they need, more specialized care, that's a good sign to refer to someone else outside of the school. And so then when you're when you're collaborating with the mental health providers, again, make sure you have that contact information right away because sometimes families don't always have it, or there's just a lag when we're waiting for families to provide it. If it's someone you have not referred, but you know that the student is working with an outside provider, then you can ask the provider or, ask the families to provide that information for you, request a release of information. And again, go ahead and call and introduce, even if you don't think you have too much to share, just kind of make a touch point, introduce yourself, say, hey, I'm working with a student, I would love to collaborate, or, I would love to tell you what we're noticing at school if you think it would be helpful for your work. And then you can kind of decide together what makes sense moving forward. So I've had some families where I work very closely with the school counselors or, the teachers, and we are regularly in contact making plans for the specific student. And then I have some where it's like, okay, you do this part and you focus on the academic and I will focus on, the mental health, and we kind of tag team. Or some people are like, this really doesn't affect us at school that much. We'll let you know if it is affecting school, but otherwise we're just happy we've connected them with someone who can deal with these issues. And that's the end, So I think that conversation is important to have just so that and then also again, just so that you're on the same page, because, if kids are coming in with anxiety and the parents are like, oh, well, the therapist told us to do this and this and this, and you're not hearing it kind of directly from the horse's mouth. We just want to make sure that we're all communicating the same thing and not making situations worse or reinforcing things we don't want to reinforce.
Andrea, can I add something to that? Because I think
Yeah.
that is an incredibly important point. I can say from my experience, parents, if they trust that you are making decisions that are or are going to attempt to make decisions that are in the best interest of their kids, they want you to communicate with outside providers. I always try to convince people we're really all on the same team when it comes to kids. I use that analogy for divorced parents a lot, is we've got to remember we're on the same team. I realize everything's complicated, but if they trust that you're going to try to make decisions in the best interest of their kid or in support of their kid, more often than not, they'll sign consent, which is incredibly important, because if they don't, and we don't have any information from the school, then we really just get information that is filtered in through the lens of the parents or that child. And a lot of times we don't get to see the full picture. And from my experience, most good mental health professionals feel like they're advocates for their patients. So then we're going to default to this mode where we advocate for them without having a full picture. And, we can always receive information. So hopefully the parents sign consent. But even when they don't, you can always leave a message. You can always send an email. We can always receive information. And the more information, the better. Most of the time.
Right. So I'm going to shift a little bit just to talk about strategies to reduce burnout for wellness professionals. And a lot of this too, I know we practice, we preach this all the time, but we're not really good at practicing what we preach. I know I'm for sure guilty of that. So in general, when you're feeling burnt out, you're more likely to doubt yourself and, not treat yourself as well. So just going back to the basics of, you know, good food, exercise, like getting enough sleep, all those like self-care things that tend to go to the wayside when we're in high stress situations. Be really mindful of that. And self-compassion. Again, this is a really hard job being in a helping profession where, again, a lot of the variables can sometimes feel stacked against you. The more that you kind of, again, have the same compassion to yourself towards yourself that you would have to someone that you're working with, the more likely you are to sort of cope with all the challenges that come your way. To talk a little bit more about mindfulness on the next slide, but we also know the two evidence-based interventions that work really well for a range of mental health issues, but also for burnout are cognitive behavioral therapy or CBT and acceptance and commitment therapy ACT. So CBT focuses on modifying those negative thoughts and behaviors that are contributing to distressing emotions or maintaining them. Um, and ACT is kind of like the new wave CBT, but it's like really focused on sorry, not so much changing those thoughts, but more accepting those thoughts and understanding that they're just part of our daily experience. And what we want to do is increase behaviors that are consistent with our values. So again, they both kind of deal with thoughts and behaviors, but in a slightly different way. So kind of some common examples with CBT is, again, in high stress situations, we're naturally going to have more negative thoughts. And some of these thoughts can kind of maintain this feeling of being overwhelmed and stressed and burnt out, or feeling devalued. So like an example, will never be able to reach this student. The more adaptive thought would be, well, the value of my work with this student may not always be evident. This parent is so demanding and unreasonable. Well, this parent is really concerned and fearful for her child and just may not know how to express or cope that, right? Again, you're switching it from feeling like a victim to feeling compassionate, and that's more likely to keep you recharged and going. No one understands what I'm dealing with work. And now you're all connected with this wonderful group of colleagues in this community here. So use your supports. And then again, mindfulness, we see this everywhere. It's like the big buzzword all around wellness and psychology and stuff. But really the core of it is being deeply engaged in your present and kind of just letting experiences and feelings be what they are without trying to force them or change them, and kind of like letting them come, observing them and letting them go, not over identifying with them. And that can really help take the edge off when you're feeling overwhelmed. And then, so some of the kind of core principles, so mindfulness is a big part of ACT, but so is cognitive diffusion. And again, so CBT is really like, let's look at that thought, analyze it, change it, make it better. But sometimes that's not always helpful because those thoughts, especially if they're kind of intrusive and constant, it takes a little bit more of a gentle approach to thought. And instead of changing them, we just want to change our relationship with them. So instead of, again, thoughts being absolute facts and truths that have this power over us, we just recognize them as mental processes that come and go. And we kind of just let them be, without over identifying with them. And that can sometimes, again, ease our coping and ease our distress. And again, we've sort of just have this acceptance that distress and negative thoughts can sometimes be a normal part of our reality, especially when we're in stress situations. And then just the kind of generally connecting back to what we think is important for us. We all kind of came into helping professions for a reason, and it's easy to forget that in the middle of all the stress and challenges and crises that pop up on a day to day. So connecting back with those values and making sure that you're setting the right boundaries and honoring what's important to you, again, makes life just a little bit easier. So I'll stop there because I want to make sure you guys have time for questions with us later. But thank you very much.
Thank you so much, Andrea. And I'm going to stop screen share just for a moment while we switch over to hear a little bit more from Dr. Pearson. Thank you so much.
Hello. Joy and Heather asked me to speak about collaboration with parents and the community. And I just sort of building on what Dr. Appapillai mentioned, she talked about challenging parents and how to engage parents. Dr. Koury emphasized the importance of gaining the trust of parents. And I thought what might be helpful, or at least one thing I might be able to bring to this conversation, would be a brief overview of some of the programs that we have found beneficial for building relationships and trust with parents, as well as serving students, supporting mental health, and creating a positive school environment. So here's sort of the overview of what we could talk about today. And I will, excuse me, one sec. I will try to focus most on programs where, parents are heavily involved. But I think one of the reasons that I wanted to at least mention all of these and share these as ideas for you to think about, sort of as parents are, of course, happy when their students are happy and doing well, when their students are being well served, and also often when their students are serving as mentors or school leaders, and students are feeling recognized and appreciated for who they are at school. So I feel like all of these programs do that. And so I wanted to at least mention them. And also many of these programs, parents were key to getting them started. Sometimes some of them, it was actually a school counselor or a teacher who had the idea and saw the need for something. But usually, because everybody, all school staff, student support staff and teachers and administrators, everybody has a full plate already. You have full-time jobs. So it can be daunting to start something new, but it can also be incredibly rewarding, especially when you're creating something in response to a real need. And often there are parents in the community who, will provide a lot of resource and support for free. So in terms of overview of what we could talk about, some of the student support programs include a wellness center, mentoring programs, student-led assemblies, and a program, it's actually not actually at school, but it serves students that parents created called Launchpad. Perhaps I'll spend most of my time describing our grade level discussion groups. These are like parent support groups, basically. And I think we might go into parent education speaker series. We can talk about issues with that, but we might not spend too much time there. And you all might already be familiar with Common Sense Media, Mindful Schools, and Challenge Success. But those are also programs that provide parent education and support and are sort of easy for schools to adopt and provide a lot of structure and support. So starting with the Wellness Center, I know you're all probably familiar with wellness centers, but just briefly, we developed ours about 20 years ago, primarily to offer confidential counseling on campus. Students can drop in or request an appointment through the guidance counselor or use a link on a website. They can also refer friends, or parents can refer students. And we have 6 interns who see students, as well as 2 clinical supervisors. Our school nurses also have an office in the Wellness Center. And we have found it's critical to have a very welcoming person who's physically present there, who can greet students who drop in. Often in the school culture has really embraced the concept of the Wellness Center. And in fact, it's been something that's like a defining characteristic of the school. And then more broadly, you know, even our community and our town has really embraced this idea that basically any student who feels the need to take, you know, at least a 15-minute break, any teacher would give them a pass if the student just says, I need to go to the Wellness Center, even if it's right before the big math test or whatever else. And these are some of the common issues that are addressed during the scheduled or drop-in sessions: anxiety and depression, sexual orientation, gender identity, body image, family challenges such as grief and loss or relationship stress with parents, peer relationships, breakups, bullying, feeling excluded, online issues, academic stressors, anything from feeling bad about a grade. Sometimes it shows up as procrastination, self-harm, difficulty with study skills. Students also present with questions about sex, substance use or abuse. And the center has a lot of resources and referrals, pamphlets in the waiting room, as well as, of course, the resources that the therapists can bring to the students. Some of the mentoring programs are, well, one of them that I have just loved. Again, I'm just a big support of any time that older kids can build relationships with younger kids. And the Youth Educator Program has been something that our students have always been really proud to be a part of. It's a transformative experience for the students that get to be youth mentors. High school juniors, in the fall of their year, they're selected to mentor and teach 8th grade students about some of the realities of high school. This has been going on for about 20 years. In fact, it really started with a grant about drug and alcohol awareness to bridge the gap and create mentoring relationships between middle school students and high school students. And now, of course, the curriculum has been updated to include, you know, kind of newer topics, exposure to, you know, the awareness of academic stress as that's become bigger, pressures with social media, decision-making, self-advocacy, self-care, exposure to marijuana, vaping, these kinds of things. The idea is that the student mentors go through a rigorous training program, mostly on weekends and after school, to prepare them to go into the 8th grade classrooms in pairs to lead discussions once a week about these topics. And then when the 8th graders show up on campus as 9th graders, they're given a welcome by their YEDs, their youth educators. And ideally, the seniors are still meeting with those 9th graders, you know, for lunch and whatnot throughout the year. Affinity Mentors is a newer program for us, but it's been heartily embraced and very, very helpful to center experiences of minorities, cultural, ethnic, religious, neurodiverse, gender expansive students. And so older high school students are the affinity mentors. They're matched with middle or elementary school students with similar identity, and they have age-appropriate sort of fun activities and lessons. And so these affinity mentors then serve as positive role models and supports. And the idea is really to normalize differences without shame, fear, or rejection, and to help both the younger students and the mentors feel good about themselves in our school and broader community. I just briefly will mention a few of our school assemblies, which are important in terms of communication with parents, and these have become such a part of our school culture and school identity. The consent assembly was started about 15 years ago also, and it includes dramatic presentations of students, real stories from Piedmont High School students of their experience with sexual violence or consent. And basically over the years, students came to our acting teacher, who's still with us, thankfully, and she started collecting these stories, and other students would act them out then for the students, actually, because it changes a little bit year to year, but basically our students see the consent assembly when they're ninth graders, the beginning of ninth grade. A lot of the issues, these kids are a little wide-eyed at that point, and then they see it again when they're seniors. And it's sort of so that it doesn't, in a way, get old, but they evolve so much from ninth grade to 12th grade that it feels a little bit like a fresh experience. And this assembly, of course, it fosters empathy by showing a variety of perspectives of students who have, this lived experience, from survivor to perpetrator to bystander. And now there are also educational, there's sort of a curriculum that has been developed to help the students who are in the assembly, and as well as the teachers at the school, talk with the students who have seen the assembly the next day in class, so they can have kind of a debrief about it. And also the assembly is performed for parents and anybody in the community, or any other students. If 10th or 11th graders want to see the assembly, they see it earlier in the week on one of the evenings. I Am Here is a similar format. Again, we're pretty fortunate to have this acting teacher who is so good at helping students taking stories of real things that have happened to students and putting them into a format that other students can perform them. And this was really to amplify the voices of students with diverse experiences. Black, Asian, Latinx, gay, and transgender students shared their lived experiences and about whatever their struggles were, some with racism, feeling like an outsider, having low self-esteem. And this was the first time, because of COVID, it was kind of put off a few years. I don't exactly know how it will evolve, but even the process of putting together something like this is really meaningful. The students who were presenting it had presented to the parent club and to the school board, and it was very empowering to know that the school cared, and that the administrators and counselors and this teacher and other teachers were helping support students to write down their stories and share their stories in a way that felt safe, because these were because they had other people, the acting students, actually on stage sharing the stories. And actually, before I go on to Launchpad, I want to just mention one more kind of assembly, which to me has been one of the most positive and meaningful things that our school has done to create a welcoming environment for students. But again, parents really appreciate knowing, even if the parents aren't directly involved in this, they really appreciate knowing that the school cares, and the school and students at the school will provide a safe and welcoming environment. And so again, it's the same acting teacher. She asks like 8 of her students who she gets to know during the year. These are generally juniors and seniors, sometimes sophomores, to join her at an assembly for the 8th grade students in the spring of 8th grade, and this might be hard for some of your schools if the kids are coming from, if there's not an obvious feeder school, but where there is a feeder school, it is really powerful to have some of the students, in this case, share their true experiences of something that's been a challenge for them. Usually there is somebody who talks about their struggle with an eating disorder. Sometimes they're still in the midst of it. Often they've sort of worked, through it and they're more on the other side. Someone talks about being, maybe a racial minority or feeling slurs against their race or religion. Somebody might talk about what it feels like that they don't feel so smart. They feel like they're, they have challenges with learning and they feel kind of stupid in our community that really values academic achievement, or not a good athlete. It can be whatever might resonate to these students. A student usually talks about what it felt like when they were dealing with some alcohol or drug addiction and issues and how hard that was, or maybe about parents and what it was like when their parents were either going through divorce or maybe even they lost a parent. But just these kind of brave students briefly sharing their real experience, and the message to the 8th graders is always, you are not alone. Be yourself. And it's normal to have things that are hard. And you can't always see somebody and know, if someone is having a challenge or not. Be kind. It's important to talk to someone. And it's just such a nice and great message, I think. And again, even though the parents aren't directly involved in this, I was really only able to come listen to these because I was on the Board of Education and I kind of attended everything. This is really meant to be a student-to-student thing, but it really builds goodwill among the parent community to know that something like this happens. Okay, going on to Launchpad. So again, Launchpad, I mentioned, is not actually a school program, although it's been embraced and supported by the administration and the counselors. Basically, myself and a few other parents created this about 9 years ago to provide an opportunity for high school seniors to learn about healthy relationships, to identify their personal values, goals, and priorities, and develop a strong sense of self as they were about to launch. And one of the things the students most like about this program is that it gives them an opportunity. Generally, it's every 3 to 4 weeks, about eight sessions through the senior year, to have heartfelt, genuine, and deep conversations on topics that feel very relevant to their lives. We survey students to find out what they're most interested in, and some of the topics are things like reducing stress and promoting wellness, awareness and personal safety, sex education, financial literacy, mindfulness, meditation, a structured approach to decision-making. This often comes in March as people are trying to decide where they might want to go to college. Healthy coping skills and strategies, taking care of oneself at college, what your body needs to thrive. And then the last meeting of the year, we always bring back college students who have graduated from our school to, meet with them, really kind of give them advice for college and, answer any questions they have. And so, although this one is organized by parents, no parents are present at any of these sessions. We hire professional facilitators who are experts in their field to lead these meetings. And then the meetings are generally in someone's backyard. Sometimes they've been in a community space or school library. It's kind of nice to get these off the school campus just because, but actually any comfortable space on a school campus would be fine for them too. All right, moving on to school partnerships. I won't spend too much time with this, but I am just such a fan of some of these programs. And again, I think the resources that they can, resources and sense of professional expertise is a really reassuring thing for parents to know. The schools and school staff are working with these organizations. Piedmont Middle School has been using Common Sense Media's research-based digital citizenship resources, which teach students, educators, and parents tangible skills related to internet safety, media balance, how to manage online relationships. And their K-12 curriculum is free, so it's used really in classrooms throughout the country. I didn't put it up here, but another one that I love is called Mindful Schools. And I know Dr. Appapillai mentioned mindfulness, and this is I think there are other organizations that do this too, but I think Mindful Schools, which is actually based up here in Northern California, is one of the first. It is one of the things I think educators tend to love about going through the Mindful Schools program is it first supports the educator. It kind of comes from the perspective that first you need to support the adult, and then once they sort of have a program to help educators address their own stress and reactivity and negative habits, and reconnect with their strengths and help them become more intentional and grounded and fully present. And then, of course, also provide strategies and ways that educators can incorporate mindfulness practices with their students. And Challenge Success is just one of my favorite organizations, and actually is very much for parents as well as for schools and students. You might all be familiar with it, but I did just want to mention, so it's been around, it started about 20 years ago at Stanford, Denise Pope. And the idea is really to use research-based strategies to improve student well-being, belonging, and engagement. And the Challenge Success team works with a school team that looks at what the issues are in that school, on that school campus, in that community, and they try to make real and tangible changes. One of the ways to identify what the needs are in the school community is to take a Challenge Success survey, which really looks at students' feelings about academic challenges, teacher and parent support or pressure, homework and stress and sleep. In addition to, there's also the California Healthy Kids Survey. Each of these are sort of offered. In our school, we do one year and one the next. So we sort of alternate years. And the California Healthy Kids Survey has related but slightly different information that they solicit. It's self-reported stress, anxiety, drug use, self-harm, that kind of thing. And so based on these, the data and observations on campus, the team at school is constantly looking at how to brainstorm to better, make, as I said, some tangible changes that can support students. It's encouraged. Our school has a student Challenge Success Club, which, involves a lot of students. Maybe they meet every 2 weeks or so and try to come up with their own ideas and initiatives. For example, one thing our students thought was they wanted to get to know their teachers more. And so, like, as people. And so now we have lawn chair lunches where we invested in a few lawn chairs, and the teachers bring their lawn chairs out, and then there's, blankets, and students sit around and chat with the teachers. And that's been just kind of a fun thing. So there's the Student Challenge Success Club, and then there's also the leadership team, which involves a couple of the student leaders and our school principals, a couple counselors, a couple teachers, some parents. And this was a group that, at least in our school, would meet every, at least once a month, sometimes more often if there was a, depending, to look at the data and really try to identify what the key priorities and issues might be, and then to see what kind of changes they could make. And I think it's meaningful. My mom was a high school principal. She was the principal at Palo Alto High School for many, many years. And she thinks, she said, it's just so hard to actually make real changes on a school campus. And she thinks it's meaningful that, because of the Challenge Success partnership, you've got the data, you've got the students, you've got the parents, you've got everybody and the faculty, right? The faculty working together. We changed our bell schedule so that school starts 30 minutes later than it used to, so students could get more sleep. We shifted the school calendar, so our fall semester, instead of ending in the end of January, now ends in the middle of December, so students wouldn't have homework or the pressure of finals after the winter break. We developed some class schedule planners where students map out what their extracurriculars are, how much time they take, how much sleep they need, how much time it will take to have fun and relax, their playtime and downtime, and try to make sure they're making very thoughtful choices about which classes they're taking, not just sign up for all the APs because they think that will give them the best chance for college, but really trying to help them be thoughtful and realistic about what choices they're making so that they're more likely to succeed. And we do fun things like bring therapy dogs and treats to school during finals. So, and of course, Challenge Success also has a lot of online resources, and now they're available by Zoom also. But maybe from your community in Southern California, I would just highly encourage you, if you can build a Challenge Success relationship and then encourage a team with some of you and some parents and some administrators and some students to come up to Stanford to their annual workshop. That's such a great opportunity to really get some new ideas and energy around some changes that you could make on your campus. Okay, so I think one of the things that that Heather was the most excited about my talking to you about, I'm calling them grade level parent discussion groups, which we have in our community for 6th through 12th graders. And these are groups, this is entirely a parent thing, but that works with the support and with some communication and sometimes collaboration with counselors and administrators at school. Basically, what these are groups of led by trained parent volunteers who facilitate monthly meetings throughout the school year. So, for example, I started leading when my oldest daughter's 25 now, was in 6th grade. I started leading a group for 6th graders. And we decided these would meet in the evening. We had so much interest. They're so popular in our community that we decided we'd also have one that met on Friday mornings. This has become a little bit more of a mom's group because there just happened to be, but most of them the group was started by dads. The evening groups often have equal number of, men and women who participate. But this first Friday group that we started, 13 years ago, has still continued to meet on the first Friday of every month because people find, and it's still inclusive. We still have new people coming in. They just need to have a child who graduated from, in 2016. Some of these parents actually didn't even go to the public high school where my kids went. They went to private schools, but these are people who live in the community and they want to be a part of this group. And these meetings are, we can go into a little bit more detail about how we run them, but the idea is it's sort of like an informal parent support group. We tend to do a check-in. Anybody, if people know that there's a topic that they want to address in advance, they can email the leaders and let us know. But otherwise, often with the check-in, people will mention if there's something that they want to go into. So everybody has had sort of a chance to talk, and then we spend about 45 minutes talking about whatever the topics are, and then sometimes at the end we'll close out with a little bit of something to toss in or take away if people have one more thing they want to say, or if they want to share something that they want to take away as something that really felt meaningful to them. And so I'm sorry, I probably should jump down here to the summary. I just wanted to mention that, so the administrators and counselors at the schools have found that these parent discussion groups are fantastic for them, because if there is something, if parents are getting all, in a twist about hearing about cheating at the school, or thinking there's too much, whatever the hot issue is, they're worried about, they've been hearing about kids vaping in the bathroom, or, whatever the thing is that might be kind of alarmist. The leaders generally help kind of tamp down alarm. They try to spread real information. And they can also communicate back to the principal and say, this is kind of what we're hearing. It just really helps with the communication. So just in closing, I wanted to mention these programs because I do think that they provide so much benefit, not only to students and educators in the school community, but also to parents. And I really do believe that partnering with parents can help a school achieve its goals, and also can be a way to really provide support for educators. And I think that I thought that Dr. Appapillai's presentation was excellent, and just wanted to build on and reiterate the importance of trying to build a relationship and focus on communication. And I feel like, as Dr. Koury said, the importance of gaining the trust of parents, the more different ways that you can help support a positive environment for your students and develop these relationships with parents. Although it might seem to take a little bit of time, I think it will also reap great rewards. So hence the garden. Thank you very much.